Okay, here we're going to go over CenterCross and MicroCross prep, and we're also going over the steps on how to insert CenterCross and MicroCross in the body and deploy at a lesion and cross a lesion in many steps. So, it's going to come out of the box like this. CenterCross Ultra is going to come in a hoop as of so. As you notice here, the scaffolding is actually open inside the hoop. That is normal. All of our CenterCross devices and multi-cross come open and shipped open because of the scaffolding. We don't want any heat of the nitinol to remember it being closed and it can collapse things down. So they're always sent open. As I always teach in the lab, I take it, tell them to put it back on their back table, unlatch, and have the lures pointing towards the ceiling. First thing you want to do is have them close the scaffolding, and then you're going to do the flush ports. One here, hard flush, and then you're going to flush the back, and this is actually flushing the wire lumen. You're going to tighten the TUI down, or you're going to have them hold their finger over the port. I just tighten the TUI down, and then do a flush. And that's just going to flush the wire lumen. Either you'll leave it in the hoop until you're ready to use, or, in this case, since we're ready to do the case, I'm going to pull that out. We're going to set that down for the time being because we're going to get the micro ready. Don't have a package for the micro, but this is the hoop that it comes in. Pretty simple. We're going to detach, small flush, just about a cc or so of fluid, and then you're also going to flush the other side. Flushing the other port actually activates the hydrophilic coating, gets it nice and slippery so everything is working well. Flush both, take that out. And in this certain scenario, we're going to leave this down as well. We're going to get our wire, and we're going to introduce them all together as one and take them into this model as a unit. And we always suggest that you take down the CenterCross with a microcatheter of some sort, whether it be MicroCross or one of the competitors, but it should always go over something. If you have an 035 wire, then obviously this is 035 lumen, so that is also recommended to go over 035 wire. But if it's going over anything smaller, you should try to suggest it to go down with another device. So right now we're just building everything, and I always suggest to do this on the back table before they bring it up to the front table for the patient to introduce to the patient. So having them build on the back table is just more convenient for the doctor, more convenient for the case. You can help them with this process. Makes it nice and intuitive. So everything is right here. We're going to introduce it into our model here and through the guide. Now just on side notes here, your CenterCross Ultra and CenterCross Ultra LV and multi-cross are all 6 French compatible, 7 French guide catheter compatible. So you always want to lead with the wire, obviously. So we're going to bring our wire down to our lesion here. We're going to pin the wire. And we're going to bring down our microcatheter. Like I said before, you always want to try to have this go, your CenterCross to go with an object, unless you're using 035 wire. If you're using 035 wire, then obviously no microcatheter is needed. We should always try to do this with a microcatheter. So we're down by our lesion here. We've got our microcatheter and our wire. Now we're going to advance our CenterCross Ultra down. Perfect. Now we're at our CTO. So we're at our pseudo CTO here. We're going to start deploying the CenterCross. Everything is ready to go. The thing here that we have to remember is that there is dead space in the catheter, so about 1 cm of dead space here. So what we're going to do is we're going to, and you're going to tell your docs this and make them aware because you don't want them to be surprised, but you're going to take this catheter back and start deploying it. Take it back about 1 centimeter. And then you're going to reposition if needed, which we didn't have very much movement there, but want to make sure, because that dead space can make it jump back on you. Then we're going to fully deploy the rest of the catheter here. Fantastic. So we are deployed. So once you're deployed, you want to make sure your doctor isn't pushing or pulling on this catheter. They may pin or hold this portion if they just need some stability, but other than that, they should be all working on the wire at this point and the catheter. So we're going to start introducing the wire to our CTO. We're actually getting somewhere now instead of before where we weren't driving through, and we're going right to the center here. I say I'm getting stuck, my wire's starting to buckle, so I'm going to advance the microcatheter now and use the technique that we've been teaching. Perfect. And advance the wire a little bit more. Great penetration. Now I'm kind of stuck here. My microcatheter doesn't want to move either. So this is part where we're going to start to spin. So spinning can be done two ways. The way I like to teach is actually spinning with the catheter. A lot of physicians like to spin with the wings, but I personally like the catheter. So if your doctor is okay with it, or if they also agree, like to come right up to the hub, spin it like you're I don't know what you're doing, something on your fingers, but I like to spin it like that in my fingers, either clockwise or counterclockwise. So if it stalls out, you can always go the other way. No issues, no problems. And it's a spin and push, spin and push, spin and push. That forward pressure is important. You can't just spin this catheter and expect anything to happen. If you just spin it, nothing is going to happen, no forward movement. But if you spin and push, torque and push, you can see we can get that wire right at the end there. Yep, we can. Keep spinning it. We're getting, and that's it. So overall, that's from start to finish and how to introduce CenterCross and MicroCross to a CTO, and also the prep for MicroCross and CenterCross Ultra. Thank you.